great to be with everyone today. So I'm Brendan Cox. I'm the Director of Policing Strategies for the Lead National Support Bureau, and I will be moderating today's session for Envisaging the Future of Policing. It's my honor. Somehow the least intelligent person on this panel is the moderator. And since you can all see my face, I would normally say that's because of looks, but you can all see me, so that can't be possible. So it is great to be here today. So a couple of housekeeping items. The chat is open if folks want to ask questions. We're going to get to a Q&A session later on, but if folks want to put stuff in there, we'll make sure we get to your questions later on. We do have a couple of folks that will be speaking in Russian, and there's going to be a Russian to English interpretation. If you would like to get that interpretation, you can go to the bottom of your screen, and at the bottom of your screen, there is a globe. If you click onto that globe, it will prompt you to be able to click which language you would like to be able to listen to this in, either English or Russian, so that way you can listen to it in whichever language is your preference. So if anybody would like to do that, you can do that. And then in the chat box, there is also further instructions for folks that are looking for more information. If they have any difficulties to getting that, there's information in the chat. So I just want to start off just thanking a few people. Nick Crofts, who is the Executive Director of GLEFA, and is listening with us from Australia today, early in the morning with us. He is the person who helped get this whole project off the ground. So I just want to thank him. And then the executive team, Melissa Jardine, who's also on today, very early in the morning herself. And then Tim France, Mark Rapansky, and Bill Stronach, who are also part of the executive team. Today, you are all going to hear from the researchers that are doing a lot of the hard work in this project, which I will explain what the project is momentarily. And then we have a long way to go. But I just want to introduce our panelists. They're going to give you a little more information about themselves momentarily and talk about some of the things they've learned. Maureen McGow, who is the Chief of Staff at the Policing Project at New York University of Law. She is doing our North America component. Jaime Orendando, who is a PhD candidate in global public health at the University of California, San Diego, who's doing our South America component. Michelle McManus, who is the head of criminal justice program at Liverpool John Moores University, who is heading up our Western Europe and UK component. Krisenpong Putaku, who is a lieutenant colonel in the Royal Thai Police, who is heading up our Asia Pacific work. Munya Katumba, who is a senior program manager at AIDS Funds in Africa. He is heading up our Africa component. Erkin Iriskubov, who is the director of Faculty of Economics, Computer Technology, and Humanities in Kyrgyzstan. And last but not least, Ilim Sadikov, who is a program manager with OSF in Kyrgyzstan. And I've been lucky enough to work with those folks. So you may be all questioning why we're here today. Well, 2020 was a year that I think we all want to forget, but we can't forget because it was a year that we all learned some very, very difficult lessons. It was a year that we saw a pandemic hit the entire globe. An unbelievable amount of people not only got sick, but died from that pandemic. It hit us economically across the world. And we're still all feeling the strains from that pandemic. And it taught us a lot in both the criminal justice field and the public health field. And then we saw an incident happen here in the U.S. in Minneapolis where George Floyd was killed at the hands of a police officer, and we all watched that video over and over again. And although there's certainly been calls for police reform before that, this one hit, I think, more difficult than anyone we've ever witnessed. Because tragedies in the past, I think there's been folks that have been, hey, we got to look at both sides of it. We got to see what's happened. Maybe it was a tragedy, but hey, we got to look at the different circumstances. And this was one that no one said we got to look at the circumstances. Everybody said we need to make sure we have change, that this cannot be. And it didn't just happen in the United States that folks saw that. It was across the globe. There were protests. There were people taking to the street and people saying we needed to make a change. And we're all in that reform moment, and we're all in a place that we know that needs to happen. And that brought out the Defund Police initiative, or I should say protests. And folks were kind of saying, okay, what does that look like? If we are now in this pandemic and we're now in a place where folks are saying defund the police, what does that look like? So the one thing I love about GLEFA is that GLEFA is full of folks from academia, full of folks from research, full of practitioners from both the criminal justice world and the public health world, and full of some advocates. And folks tend to get on email strings who have ideas about what we can do differently and what we can try to really learn from each other from around the globe and how we can do better. And ultimately, this project kind of got taken on from a group of texts, or a group of emails, I should say, around this group of individuals that just got on an email string and started saying, like, hey, there's this movement now. Like, what do we do about it? Like, how can we play a role? How can we make sure that folks can learn from each other and we can know what's out there? Like, what are alternative responses to what we currently have around the globe? Where do we intersect between the criminal justice system and the public health system in those responses? As somebody who's been in law enforcement for 27 years, in many ways, many of the issues that societal issues have been kind of left at the door of the police world, that you're out there 24 hours a day, 7 days a week, 365 days a year. So you deal with issues around mental health and substance use and violence and see what happens, and you figure it out. We've seen other systems break down. We know other systems have issues, and the public health world is a world that I think a lot of us have looked to in the criminal justice world to say, hey, what solutions do you have? How can we work better to deal with what's going on? So the Envisaging project really came into being of saying, hey, how can we look at what is going on around the world, how we can take what's happening around the world for some alternative solutions for places where public health and criminal justice are working together for alternative responses, and how can we learn from each other, and how can we ultimately take some research and see what is proven, what's not, and then if we know there's solutions out there, what does it take to right-size those? What does it take to bring those to capacity around the globe? What does it take to bring those to different places, and what do they look like when you bring them to different places? And what are the resources that you need? And recognizing that it's very easy to say, hey, for a mental health crisis, stop sending cops, start sending social workers. That's an easy statement to say, but that's not easy to carry out. And if you do it wrong, we might wind up in a worse crisis than we're in now. So let's do it right. We all remember, well, not everybody, I'm old. We all remember the folks that are old remember in the 70s and 80s when we closed all the psychiatric centers around the US, and we didn't really have a very good plan for how to deal with folks in the community with mental health. And thus, that's why folks dial 911 in the United States when people are having a mental health crisis and don't call other folks. And that is one of the reasons why police are on the forefront of dealing with mental health crisis in the US. So if we're going to do something different, or if we're going to push a certain response, let's make sure it's right. So that's where this really is driven out of. And today you're going to hear from our researchers about some of the things they found so far and some of the things we think maybe we can do some work with around the globe. So without further ado, because you do not need to hear from me any further, I'm going to turn it over to the researchers. And the first research is around what we found in North America so far. So Mo, you are up.
Excellent. Thank you so much. All right. Are you all seeing my screen? Brendan, can you see my screen?
Yes.
Excellent.
You are up. Yep, it's up. I apologize.
Perfect. Yeah, no worries at all. So thank you so much, Brendan, for that great introduction and really fantastic overview of the issues that we're sort of grappling with at this particular moment in history. As Brendan mentioned, I'm Mo McGough. I'm a chief of staff here at the Policing Project at the New York University School of Law. We're small but pretty mighty, we think, nonprofit. We really focus on democratic engagement, so ensuring the public has a meaningful say in how they're policed. And we also focus a little bit on civil liberties and civil rights in the tech space, and most recently, a pretty significant increase in our work around reimagining public safety and redesigning systems to actually meet social needs with social interventions. So I am thrilled to lead the team of North American researchers to try to understand exactly what's happening in North America with regards to public safety, public health interventions. Brendan mentioned this a little bit, but I think it certainly bears a little bit more having a little bit more of a focus on it, just because it has been so significant in this country, and that is the police killing of George Floyd in Minneapolis. There was some traction for public safety, public health partnerships, and sort of more comprehensive interventions, but we've really seen significant increased attention to these types of interventions after the police killing of George Floyd. One of the things that happened is people really started to understand just how much we ask the police to do, and just how ill-equipped they are based on their training and skills to do some of those things. So there's an interest in trying to understand, how do you disaggregate that police function? How do you narrow the scope of what the police do to actually be in line with what police were sort of set up to do in the first place? And then the second and probably more important focus area is, how do we best address non-enforcement problems with effective solutions that don't rely on enforcement and over-criminalization? An aspect of that is really reorienting public systems towards global community outcomes. There's sort of this false dichotomy that's grown up. It's either a public safety issue or it's a public health issue, and we measure different outcomes and we use different interventions. But really, the underlying needs of the people who are cycling in and out of those systems are the same. We've got some research here in the US that shows in certain jurisdictions, and I imagine it applies a little bit more broadly, the people who need the public safety services, the people who are cycling in and out of our jails, are the same people that are cycling in and out of emergency rooms, for example. So if we start to sort of if we start to unify those disaggregated responses, we might be able to design interventions that interrupts that cycle. Not only is it better outcomes for communities, but we anticipate there would also be cost savings to jurisdictions as well, because those small number of individuals take an outsized amount of the resources. And then finally, and most importantly, we're doing all of this under the context of dismantling systemic racism in all public institutions. And I'll speak a little bit about that later. But it's a flag that we throw as often as we can, because we think some of these solutions are starting to be oversimplified. And this type of systemic historical problem is not going to have a simple solution. And that's part of why we're so excited to be connected to a research effort where we can actually measure and understand outcomes and make sure these disparate impacts are not continuing in the solutions that we implement. I want to sort of breeze through some of the models that we're seeing here in North America, because I know we don't have a ton of time. But basically, it really boils down to either co-responder models, alternative non-enforcement models, or improving law enforcement's ability to respond using public health interventions and approaches. So co-responder models are exactly what they sound like. There's a fantastic example in Ontario, MCCRT. And that's basically that for certain types of issues, a mental health or behavioral health or social worker would co-respond with a law enforcement officer and hopefully connect that person to services as opposed to rely on an enforcement response to handle that. The second is alternative non-enforcement models. Cahoots in Eugene, Oregon has gotten a ton of attention since the police killing of George Floyd. They basically have a mobile unit of mental health professionals and first aid to go and intervene and stabilize situations and not actually use enforcement in any type of way. And then finally, it's about improving the police department's ability to respond to public health issues. For a host of reasons in the US, police are who we call for all of our emergencies. So improving their ability to do things like de-escalate, to recognize symptoms of mental health, and to actually, be part of a solution that doesn't involve enforcement. The other way we're getting there is through pre-arrest diversion. Brendan could talk about this at length. It's the idea that rather than using the criminal justice system, it's diverting people in lieu of arrest to other types of solutions, such as substance abuse treatment. And then finally, we're starting to see a growing number of alert databases where if you have a family member, for example, who is living with a mental health issue, you can report that mental health issue to emergency services, and they'll flag it in a response so that, any type of law enforcement officer who's responding to an emergency in your home understands that there's particular mental health needs that need to be met. Perhaps they can send a co-responder, but at least they understand what they're going into. I want to speak really quickly to the limitations. I know we're going to get into this a little bit later on. I mentioned this at the beginning, the systemic racism that pervades all public systems. I think what we're seeing a lot here is a narrative that, there's disparate impacts in the criminal justice system. Let's shift it over into the public health system and we won't see those disparate impacts anymore. And that's just simply not true. When you look at our pandemic impacts here in the US, there's hugely disparate impacts in our Black and brown communities. So we can't just simply think that shifting to a public health response is going to eliminate those disparities. Data sharing is pretty complicated here, particularly around some confidentiality in terms of health versus safety. So we need to do a lot of research to identify those high need users and make sure that we have those interventions that are actually based on evidence. The biggest challenge I think that we're facing is how you determine risk at dispatch. So these alternative responses are only going to work if they're actually dispatched to the appropriate calls. And if we don't have a better evidence base behind, what requires an alternative response and what requires a police response, you could have many of the same risks that you have today. You send the police when they're not needed, there's a risk, particularly if there's a mental health crisis involved. You don't send the police when they're needed, that's a different type of risk, but there's a risk of harm all around. So we need to really strengthen the evidence base there. Time-bound response, obviously resources right now, 24/7 response from police is pretty much the only 24/7 option we have. Practitioner implications, I think we need to work really closely with public health officials who maybe didn't sign up for being the go-to response at 2 a.m. without police when there's somebody who has a weapon and is having a mental health crisis, for example. And then finally, resources. All of these alternative responses are costly, and we have a lot of jurisdictions with a lot of different types of capacities, many of whom are under-resourced, particularly after the pandemic. So how do we actually afford these types of responses that we so desperately need? And I know we'll go into, that's a lot, but we'll go into more of it during the Q&A. And I think now it's turning it over to Jaime.
Hi, everybody.
Thanks, Mo.
I'll start sharing my screen. Perfect. Can you see my presentation?
You are good and ready to go, Jaime. Thank you.
Perfect. Thank you so much. Just to clarify, hi, everybody. My name is Jaime Redondo. I'm a professor of drug policy at CIDE in Mexico City. We are 10 years into the consolidation of a program, the only program looking into drug policy in Mexico. And I used to work for many years now in harm reduction, and I want to introduce what we've been seeing in the Latin America working group. So right now, I want to talk about how the region really has a diversity of approaches across the region. I would say that we have broadly three types speaking. One, that it relies more on police response by modifying certain policing tactics or adapting to alternative policing strategies. And we have seen throughout several places in the region. We can see that in the community security bases in Bahia in Brazil, or the project of the PPP or pacifying police units in Rio de Janeiro. Some other approaches have gone more with an alternative non-police response, more about mental health that includes social cohesion and harm reduction actions. Some examples of this can be also found, for example, with the mental health centers in Peru, the newly opened Colibri centers in Iztapalapa in Mexico City, or the Escudo harm reduction project in the border between Mexico and the United States. But others have relied mostly on police and civil society collaboration through sensibilization initiatives and collaboration agreements like Red Trans-X that we will present a little bit more details on that. What is the current status, however, is that several have existed for decades and are still evolving, consolidating into programs like the community security bases in Brazil. And others have encouraged these multiple goals, including sexual and harm reduction actions, sorry there for the mistake. For example, Escudo and mental health centers in Peru. And some have bring together, like I said, police and civil society efforts. This Red Trans-X program that will have focused more shows that there's clearly not a clear driver for many of the projects throughout the region. However, what we can find in this success case story is that for more than 10 years, the Red Trans-X, which is the network for female sex workers of Latin America and the Caribbean, has worked to try to create a space where police officers and peers, sex workers, can sensitize the police regarding their job, their human rights protections. And the idea there is to have sex workers together with some initial funding from the German embassy, UNH, and the Honduran police, and to have to then replicate this project into many other countries. So some of the characteristics that we can show from this one is that the project, even though they started in Honduras, has led to the design, execution, presentation of these programs with a first-hand advocacy to decrease the stigma, discrimination, and institutional violence for which female sex workers are exposed daily while they're doing their work. So basically what happened is the female sex workers or their peers will train police officers in this collaborative agreement between them and the police so they can decrease the number of human rights abuses. Up to date, the network has sensitized more than 4,000 security personnel around Latin America and has, this is what is really interesting, created protocols for police operations throughout the region. Something that we have identified, unfortunately, is that not all programs have reports and best practices that will allow us to replication. However, this project in concrete, RetroSex, has a strong component of leading the peers into creating these materials so it can be replicated in other settings. However, there are certain challenges that we have seen throughout the region. One of them, and is mainly that the change in government has made it that some of these projects, so for example, the Open Arms in Brazil, that it was a really progressive initiative to do employment and housing for people who use drugs in downtown Sao Paulo, that it was canceled after a government change. Same happened, for example, with Escudo in Mexico. So these changes in government and also the changes in policing linkages with other organizations. Another problem is also the reduce of stigma for community-based organizations, right? That work that has to be done with the police officer is still difficult to tackle. And also it comes to the center that we don't have enough public resources for non-police alternatives. Usually the first approach that it will face is trying to use more the police for tackling all these other problems. And we can see that really right now with the public health emergency of COVID-19, where in some countries the police was used to enforce public health restrictions, such as use of masks in public places. So unfortunately, we rely a lot on international philanthropy to try to create some of these projects. Other of the bad things that we need to tackle is the corruption that unfortunately modifies that interaction that exists between citizens and the idea of creating these initiatives. For example, we can see these with proximity policing projects in NESA in Mexico. And clearly, one of the big obstacles in our region is the highest level of violence and organized crime that sometimes gets filtered into the security forces, and then that difficulty is the task of other organizations, either civil society or researchers of us, like us, to engage with security forces in the region. But I'll be happy to talk more about this during our Q&A session. I also would like to put here our collaborators, Natalia Campos and Sergio Melvin, who might be around there. And thank you so much. We will be ready for your questions. Thank you.
Thanks, Jaime. Very much appreciate that. And apologies for messing up the who you're with right now. So I apologize for that. So Michelle, we'll kick it over to you, please.
Thank you very much, Brendan. You'll probably start to see a bit of a theme trending now, so which is, I think, always interesting as well. Hopefully everyone can see the presentation.
Yes, we can see it, thanks.
Yes.
So a couple of things that I'll sort of touch on first. So, and again, it's quite nice to actually hear everyone together. I'm sure as the questions start coming through the discussion, you'll start to see some of the themes. And what's nice is we have independently gathered all this information as representations across the globe. And it's really nice to actually see a lot of the crossover that's been sort of discussed from the group as well. So just to first say, obviously what I'm going to be talking about today is the Western Europe and UK perspective on this, and just in very few minutes, just giving a bit of an outline as to what we've found so far. So some of the key things we found when we've been looking particularly at public health and law enforcement joint approaches and work is that there's been some really key areas of focus. And this has tended to be on violence prevention with a focus on child exploitation, a very recent kind of push due to some activities in the UK around violence against women and girls. I think seen globally as well, along with the LAPH conferences around this trauma-informed practice and approaches, which has really opened up public health approaches within law enforcement. Alongside that, what we've seen as well, particularly from a UK and Western perspective, is this really push from a multi-agency and partnership working. And we've seen this through at all levels, from a local level all the way through up into sort of more broader national levels across government. And I'll talk a bit more about that in a moment. A key thing that I think everyone's been talking about so far as well, and I'm sure you'll see from the other panelists today, is around mental health responses. And that's probably been one of the key drivers, again, around where we really do need to have those joined up approaches between public health and law enforcement. And I'll be touching on some of the projects that we've seen around this. And again, reflecting on what Mo was talking about before as well, about some of the diversions and some of the more early help schemes around substance and alcohol misuse. So what's key is when we've kind of gone through a lot of the projects, and what we've done has been gathering projects across Western Europe and UK. These are kind of the key themes and key areas that have been coming out, that have been focused, which I think is interesting in itself. Now, what seems to be working well, and what I've kind of done here is kind of combined what is working well and some of the drivers around this as well, is that, and you hear this a lot of time over many years of coming to these conferences, that there certainly is an awareness and acknowledgement that you cannot west your way out of this. And this is seen at all levels, from those on the ground all the way up to those sort of even senior politicians and ministers that are there. I talked before about kind of buy-in and this kind of joint working, and certainly from the UK perspective at the moment, what we're seeing is this kind of real buy-in from cross-government ministers and leaders. Literally this week, last week actually, because it's Monday today, there was one of the presentations I went to at minister level, and we had the ministers for serious, looking at serious violence with both the health, the police and Department of Education all sat around the table driving some of the agenda forward around how we look at serious violence and opening up conferences. So really actually having that physical, visible buy-in, as well as some of the financial joined up approaches that are happening now. Again, what's working really well is this push on changing language. And this really does help to change culture and traditional responses and silo working. So really encouraging people to think more broadly. And again, that has come from a lot of the joint funding work and some of the initiatives that have been pushed from government and from senior level out into some of the smaller projects and initiatives that are going on, really trying to buy into this language, which is more around sort of early help and more around really understanding some of the problems that exist in communities. Again, and I think this has been talked about by both panelists so far, is around this acknowledgement and need for evidence-based and evaluation. There are some limits within this, which I'll talk about in a minute, but certainly what we are seeing is this question about what does it show, where are the benefits, where does it work, where does it not work, under what conditions, and a lot more rigor and a lot more expectation, if we're honest, around funding going forward about how this works. And another great thing that I think we're seeing across Western Europe in particular, and certainly within the UK and some of the smaller projects that were initiatives locally, is around this user voice. So asking the question about where is the user in this, where is that co-creation model that's working. So really posing those questions. Coming to the problems and challenges, and this really does reiterate particularly Mo's opening presentation, and this kind of postcode lottery and around time constraints is certainly a key issue. And it's talked about a lot, particularly within the UK, around how you can just be in one different postcode and actually servicing the provisions that exist around that according to funding can be very, very different. And again, some links around sort of poverty and demand and problems with some areas getting additional money compared to others. A key thing, again, that was talked about previously was around this idea of data and databases and sharing. And I think this links a lot with what we've seen in some of the projects we've reviewed, is around, again, I suppose some of the disadvantages of having senior government and minister sort of level buying into some of the projects and funding around this. Is what ends up happening is some of those indicators, some of those measures are very short term, and actually might not reflect the reality of some of the softer and more effective work that's going on in the ground, and can actually really impact on funding going forward. So it's about how do we challenge some of the way that indicators and measures are being forced upon a lot of the funding of projects that are public health and law enforcement collaborative work. It's a real question I think we need to be pushing back onto some of our funders around this. Again, linked with that, I suppose, is around some of the targeted funding and interventions as well. So the danger of only having sort of really targeted funding. So, for example, in the UK, we've got a number of violence reduction units that obviously have a specific remit around reducing violence. So what happens to anything that doesn't fall within the remit? Does domestic abuse come into that? Does it not? How does child exploitation feature within that? So again, sometimes just asking about some of the very targeted funding, and again, reflecting on what Mo said before, but actually missing some of the stuff that sits underneath that might be a problem within that. And that's some of the stuff that's being talked about in evaluation findings from some of the work we've looked at. And just reflecting on some of the removal of universal services. So when I talk about universal services, we kind of talk about those places where our families and our children all are there and or tend to experience. So whether that's school, really, family health care, maternal checks, community support and safe spaces, and particularly within COVID, this is an issue going forward. A lot of those things have been stripped back. We're trying to catch up on what's going on at the moment in terms of education and getting back into a financial stable world. But actually, some of the communities, some of the safe spaces and those really universal services have really been stripped back. And then lastly, again, reflecting on some of the language, where there is a commitment, there is an understanding around language change when we talk about, and again, reflecting on the presentation before around, talking about sex workers and exploitation. Certainly within the UK, we've seen a real, transformation from language and treatment for our child sexual exploitation, not talking about sex or prostitution, but talking about rape, talking about exploitation. But we're still, for example, if you look at child criminal exploitation, there are a number of issues around that still being seen as a child, a young boy, being a perpetrator. And again, I'm sure this is reflected in all of the presentations today, this need for seeing the reports with the same findings all the time, but actually the inability for this to make action and change. I won't go on too much. I've put some hyperlinks there and I'm sure we'll make the presentations available, but I've hyperlinked some of the projects that are available for you to go and have a look at across Western Europe. So we've got some stuff around the Netherlands included in this, the Wales Violence Prevention Unit, some of the work that's happening across Scotland as well. And again, the co-responder models is certainly something we're seeing in Western Europe and UK for the domestic abuse and for the mental health cars. And we've got a lot of these people actually presenting across the conference over the next few days. So I'm sure you can catch up with some more detail there. But that's everything from me.
Thanks, Michelle. That was great. Appreciate that very much. So we're going to turn to Erkan and Aleem. And for folks that, for the translation, so Erkan and Aleem are going to present in Russian. So for folks that want to hear the translation in English, now would be the time to switch over. And as I have just learned, if you are listening on your phone, you will not be able to go over to a translation on your phone. So you can only do this on a computer. So for folks that need to go to English, now would be the time. And Erkan and Aleem, I'm going to switch over to the both of you to your presentations. Thank you.
Спасибо. Так. Все. Отлично. Добрый день, уважаемые участники. Позвольте представиться. Я из Кыргызстана. Меня зовут Эркин Ирискулбеков. Я юрист, действующий адвокат. В настоящее время работаю деканом факультета в Международном университете Кыргызстана. Я постарался провести исследование, это в Восточной Европе и Центральной Азии, на предмет взаимодействия правоохранительных органов и общественного здравоохранения. Вот. Ну, в первую очередь я хотел бы отметить то, что все страны Восточной Европы и Центральной Азии имеют советское наследие в регулировании деятельности правоохранительных органов и организаций здравоохранения. То есть здесь я хочу отметить то, что в этих странах, в большинстве стран остался еще постсоветский практика, где используется карательная мера, например, в профилактике наркопотребления. Вот. Карательная мера, она направлена на то, что наркопотребитель является потенциальным источником угрозы для общества, и его нужно в первую очередь изолировать и от общества, а потом в пенитенциарной системе лечить, нежели чем та практика, которая существует в других странах, где говорится, что наркопотребителей не нужно сажать в тюрьму, а нужно предоставить им доступ к лечению. Каждая страна в этом регионе, она определила свои приоритеты в сфере сотрудничества правоохранительных органов с организациями здравоохранения. Например, такие как борьба с социально значимыми заболеваниями, ВИЧ-инфекция, туберкулез, ковид и так далее. Во всех странах имеются координационные механизмы, то есть площадки по решению вопросов здравоохранения через многосекториальный подход. Здесь я хочу отметить то, что в этих координационных механизмах участвуют не только правоохранительные органы, но и другие министерства, которые позволяют им более эффективно и быстрее решать какие-либо вопросы и задачи. Также созданы успешные практики взаимодействия между правоохранительными органами и организациями общественного здравоохранения. В вопросе лидерства здесь на первом месте, конечно же, стоит это правительство, которое создает политическую и правовую базу для сотрудничества. Правительство также обеспечивает координацию участников в этом сотрудничестве. В отдельных странах гражданское общество играет немаловажную роль в обеспечении сотрудничества. Здесь я хотел бы отметить те страны, где гражданское общество наиболее, скажем, устойчивое и независимое, то есть это Украина, Молдовия, Кыргызстан. Далее международные организации, они предлагают свои положительные практики сотрудничества между правоохранительными органами и организациями общественного здравоохранения. В свою очередь оказывают различную финансовую поддержку, например, UNAIDS, Всемирная организация здравоохранения, UNODC и так далее. Ситуация в этих странах показала разную практику. Есть те страны, где правоохранительные органы и общественное здравоохранение работают вместе по многим вопросам. Это, например, борьба с ковидом, борьба с насилием и так далее. Однако по отдельным вопросам имеются проблемы. Здесь я хочу отметить, что во многих странах есть проблема наркопрофилактики, снижение распространения ВИЧ и так далее. То есть слабая коммуникация в перенаправлении между правоохранительными органами и общественным здравоохранением. Слабый уровень, как я уже отметил, также и между гражданским обществом. То есть нет единой координации, когда, скажем, наркопотребитель, который вышел из пенитенциарной системы, и должен стать на учет по месту своего нахождения для дальнейшего, скажем, лечения и надзора. Вот. Здесь система исполнения наказания, вот, оно плохо коммуницирует со здравоохранением, вот, и здесь нету также доступа к гражданскому обществу, которое могло бы помочь в этом вопросе. Вот. Что касается вызовов, здесь я хотел бы отметить влияние ЕАЭС вот, на ситуацию взаимодействия между правоохранительными органами и организациями здравоохранения. То есть это, можно сказать, такое региональное влияние, да, на внутреннюю политику государства. Вот. Не секрет то, что в Российской Федерации, вот, от которого многие страны зависимы, вот, своей профилактики, да, с наркопотребителями они не используют метадон. Вот. И, возможно, их влияние будет в будущем нести такой характер, то что, например, вот, в Кыргызстане, где используется метадон, например, в Казахстане в скором времени могут эти профилактические программы просто-напросто закрыться. Что касается примеров, вот, стратегия работы во время пандемии COVID-19 во многих странах ФЕЦа оно показало положительную роль вот, между взаимодействием с правоохранительными органами и общественным здравоохранением. Вот. Ну, конечно же, пандемия COVID-19 не самый лучший пример, вот, где взаимодействовали правоохранительные органы, вот, так как отмечается, то есть нами было отмечено то, что во многих, скажем, регионах были и нарушения прав, да, граждан в период пандемии. Вот. И также межведомственные документы по профилактике ВИЧ, ТБ и ковид. Вот на примере Молдовы, Кыргызстана. Вот, у нас, например, в Кыргызстане есть межведомственная инструкция вот, между правоохранительными органами и общественным здравоохранением по профилактике ВИЧ, где здесь идет непосредственное взаимодействие в работе вот, этих ведомств, где в случае, скажем, задержания вот, правоохранительные органы обязаны уведомлять органы здравоохранения вот, и перенаправлять данного клиента для дальнейшего лечения. У меня на этом все. Если будут вопросы, то я более подробно постараюсь ответить и раскрыть свою сессию.
Илим, давай.
Да. И также Илим может прокомментировать.
Спасибо. Коллеги, я хотел бы пройтись по общей информации, когда предоставил Эркин. Но на самом деле практика взаимодействия между правоохранительными органами и общественным здравоохранением в странах ВЕЦа, она очень фрагментарная, и, так скажем, сделать общий вывод очень сложно на этой основе. Где-то есть хорошая практика, в том же государстве может быть практика очень слабая. Поэтому мы здесь подумали, что информация скажем, о региональной ситуации, она будет очень отличаться друг от друга. Но при сборе информации от разных стран мы увидели очень хорошие практики, где уже страны смогли, так скажем, потихоньку уже отдалиться от той постсоветской практики и уже, скажем, в своих приоритетах определяют, что необходимо, чтобы две эти системы работали вместе. Система здравоохранения и система правоохранительного блока. Ну, я думаю, какие-то, если будут вопросы, мы с Эркином ответим более подробно. Спасибо.
Thanks, Erkin and Aleem. Very much appreciate that. That was great. Thank you, guys. Tong, if we can talk about Asia, please, if you can fill us in on how you've been doing.
Yeah, thank you. Okay. Good morning, good afternoon, and good evening, everyone. I'm Associate Professor, Police Lieutenant Colonel Krishnapong Putukul. Today, I'm going to talk about the Asia-Pacific region. I would focus on 4 main issues: harm reduction, response to COVID-19, gender-based violence, and mental health issues. With regard to harm reduction, many countries have implemented harm reduction programs like Afghanistan, Bangladesh, Colombia, China, Hong Kong, India, and other countries on the country list you can see on the screen. Most of the programs were led by NGOs and civil society in collaboration with government agency and public health sector. However, there are still some problems, like legal issues and law enforcement dilemma. And they still have a big challenges like the narrow scope and limited to a specific area. I have one good practice in Vietnam. The police mediate that legal and social assistance to drug users there. They have the idea of a community-based program and strong cooperation led by the police. And respond to COVID-19, a variety of ways in response to COVID-19 in Asian countries. They have used a technology-based response like a robot, mobile phone, drone. They also use the community-based response like volunteers, and they use social media to raise public awareness. And law enforcement agencies partner with public health sector depending upon resources. And I have one good practice in Thailand, in my home country. In Thailand, they have a home visit for those returning from risk areas, and they have a preliminary health check and report. They work together with local police officer in terms of local quarantine and home quarantine. With regard to gender-based violence, some countries have vigorously implemented programs related to gender-based violence. These include India, Pakistan, Sri Lanka, Bangladesh, and Maldives. They have 2 categories of the program. The first one is prevention-oriented, focusing on men or offenders. And the second one is a victim assistance-oriented, focusing on providing help to victims, mostly led by NGOs and civil society. Again, they still have a narrow scope related to a specific area, like not enough public resources and public trust toward the police. I have one good practice in Pakistan. The police set up the training program in partnership with the Islamabad Capital Territory Police and the National Police Bureau, the National Police Academy, Provincial Police Training Wing, and various police colleagues and the school. They also built the capacity and enhance the sensitivity of the police personnel for the response. And for mental health issue, many mental health related programs were implemented in Asian country, mostly carried out by the government agency and health core sector. Limited roles of law enforcement agencies still. I have one good practice in South Korea called Psychological Autopsy Project for Suicide. It aims to analyze the causes of suicide and prevent it since 2015. And they have the Korea's psychological autopsy checklist. And the police provide information on suicide victims. The Ministry of Health and Welfare Central Psychological Center conducting PA analysis of the cases. It's all my presentation. Thank you very much.
Thanks, Tom. Appreciate that. It's amazing how many of the pandemic that no matter where we were in the globe, it seems like a lot of us in policing, we're dealing with a lot of the same things, how we were going to deal with talking to folks about quarantine, and then the violence, partner-based violence, domestic violence, how much was happening around the world, and how folks were trying to deal with that. So thank you. So Munya, last but not least, how is the research going in Africa? It is now your turn. Thank you, Munya.
Good day, everyone. From wherever you are in the world. My name is Munya Katumba, and I'm representing Africa. I'm working for AIDS Funds. Just a sec. I'm working for AIDS Funds on issues related to police perpetrated violence as it regards to sex work, drug use, and LGBTI. And also developing some training materials around police arrest, custody, and pre-trial detention for vulnerable groups. Also leading an HIV and AIDS review training program for Southern Africa Regional Police Chiefs Organization, SAPCO, and I'm based here in South Africa. Today, I will give you an overview regarding law enforcement and public health collaborations and partnerships in Africa, also citing who drives them, are they working with together well, or there are problems, share a bit of some of the challenges, and give one or two examples from the Africa region. So regarding the situation of collaborations, we've seen quite a number of them, especially in responding to epidemics and pandemics. Good example would be HIV and AIDS, STIs, as well as the COVID-19. We've also seen quite a lot of collaborations around agenda setting and policy reviews on gender-based violence, as well as also on counterinsurgents or responses to terrorism when it happens within civil spaces, civilian spaces, addressing issues of rape, disease, and death. Around who's leading, we've seen quite a lot of law enforcement and other government departments as it relates to HIV and AIDS through what is called a multi-sectoral response that is mainly looking at issues of HIV and AIDS, also sponsored by through the Global Fund. There's also been quite a lot of law enforcement and civil society organizations addressing issues of human rights, key populations around abortion and the rights of girls and women's rights. At regional level, we've also seen some economic bodies, for example, Southern Africa Development Coordination on HIV and AIDS, as well as also one good example was also when they were responding to terrorism in Mozambique. Within the East and North Africa, we've seen ECOWAS, COMESA, ICAS responding to insurgencies, as well as also around maybe when they were responding to, especially in Uganda, and also Boko Haram in Nigeria, and El Shabaab in Somalia. Also looking at the situation around where the law enforcement and public health collaborations and partnerships are working, we've seen there are a number of them that are working very well, but this is mainly based on, especially if those who have long history or experience of working together. Also seen quite a lot of collaborations around working on common goals towards local, national, or global health outcomes. Despite some other collaborations doing quite well, we've also seen antagonism around civil society organizations. Is most of the times blame is put on law enforcement, especially on issues around human rights and lawful arrest and so forth. Law enforcement agencies is also perceived civil society organizations as enemies of the state, which I will elaborate a little bit further. There's also been quite a few challenges as it relates to these collaborations. Within Africa, a lot of countries, they have laws that criminalize same-sex relationships, sex work, as well as drug use. So the criminalization has actually caused quite a lot of challenges in that, for example, if countries want to relate to or address issues around human rights, equality and equity for all citizens, you would find out that certain laws that criminalize certain behaviors have become very problematic. Also, in terms of sex work, there are lots of laws around prostitution that when law enforcement enforces these laws, there have been a lot of socio-economic challenges as it relates to sex workers, as well as also a lot of issues around health and the way the certain communities address or seek health services. There's also been a lot of challenges as we've seen quite a number of backlashes, especially when you see either donors or what we term the global north, especially with the embassies that have tried to address issues around human rights, is seen as that they were supporting immoral behaviors, for example, if it's around human rights for same-sex relationships. Some of the challenges that are around collaborations have been that civil society organizations, they are very flexible when it comes to the way either they implement projects and programs or the way they are structured, which has been very problematic when it comes to collaborations, especially looking at law enforcement as rigid, bureaucratic, protocol-driven, which makes a lot of processes to be lengthy. And this has been very problematic when you look at issues of program deliverables, which in most cases you find out that civil society organizations give up. There's also been a lack of financial and human resource to maintain these collaborations. You look at issues of projects and programs that sometimes, even if the collaborations are started, there is lack of financial and human resource to implement. But also, despite these challenges, we have also seen that there are collaborations that are working quite well within the Africa region as it relates to violence and gender-based violence. For example, in Mozambique, a group of sex workers within Mozambique has been advocating for years to work with law enforcement, especially as it relates to dealing with issues of police-perpetrated violence. And we've seen police being allies of sex workers in tackling violence in Mozambique. Also on gender and abortion, we've seen that in Ghana, Nigeria, Uganda, and Zambia, there were issues around criminalization of abortion, which was problematic in women accessing health services when they wanted to either do abortion and so forth. So the good story that comes from these countries, they developed some training materials, as well as also they've started some trainings around issues of abortion, and we've seen that the collaboration is quite working well between law enforcement as well as women groups or organizations that are advocating for gender and abortion. The last one has been in South Africa, where South African Police Service, together with civil society organizations, they've started a collaboration in addressing issues relating to drug use, violence, gender identity expression, and sexual orientation, where civil society organizations together with police have been trainers in ensuring that police officers adhere to issues, or they are well knowledgeable and they change their attitudes around policing vulnerable groups as it relates to sex work, LGBTI, and drug use. Thank you very much. That's all I had for the Africa region.
Thanks, Munya. Very much appreciate that. So we're going to go into a little question and answer period, and we're going to open things up in a moment for folks that are looking to ask questions. We're going to open up live, so folks can raise their hand in a moment, and we will try to call on folks. If folks want to not do that and want to ask in the Q&A, that's fine as well in the chat. But if folks want to pop in, that's also fine. So you guys have all done some awesome work, and we see some definite common themes. One of the things I wanted to touch on, two things that I want to ask, and then we'll open things up. One is that, I think we've all seen the issue of there are a lot of really good things happening, and we're all trying to figure out what fits best and what can be brought to scale, because let's face it, it's great to see something done in like a zone or done in one city. And how do we bring that to scale? One of the hardest things is to bring something in a city 24 hours a day, 7 days a week. So that way we have right coverage, right? We talk about like mental health response, like look at that and think about trying to cover 24 hours a day, 7 days a week of making sure you have that alternative response. That's a really difficult ask. And it's also really difficult because there's, of course, politics. Michelle, I think you brought in the whole kind of the little political atmosphere. I've lived in a political atmosphere for a while. Actually, I don't live in the political atmosphere anymore. I used to live in it. So if you guys could just, folks, if they want to just touch on this, like what have you guys seen so far in your experience, either in this or in other experiences? Where does that political atmosphere fall in the research you guys have been able to do for long-term versus short-term? Like if we're trying to get initiatives that start out and do really well, how do we bring them from being a short-term project with somebody's name being like, I brought this here, to like a long-term solution? So folks, that collaboration, right? That how do we make it a collaborative approach so nobody can be like when they come in, I'm going to do away with that because my name wasn't on that. That was the other person that I ran against and I just beat. What are your guys' thoughts? And folks can just unmute themselves and just jump in if you don't mind. You guys can all do that. Go ahead, Michelle.
I'll come in there, and I think it's I've had experience of working in a police force, in a public health institution, and then in academia as well. And what I can certainly say from those experiences, and obviously delving into the projects that we have done so far, is this will never change unless we change the red, amber, greens that we have within these institutions themselves. So there's got to be the challenge, but that challenge is going to come from the ground a lot of the time. So what we need to be considering, and certainly conversations that we've been having, is how do we incentivize people to not be promoted, or because that's what you hear about. When I was in a police force, you'd very much hear about, well, actually, I'm going to drive, exactly what you said, Brendan, I'm going to drive this initiative because it doesn't matter if I don't see it through, I'm driving something and it's going to get me the promotion that I need to go to the next step. And when it comes to funding, again, just kind of pushing back, which we certainly did in public health, to government to say some of these indicators are not showing truly what we're doing, and pushing back on that on the ground, rather than looking at reduction of violence incidents, knife crimes. Actually, we got to learn and got to push back on some of this and the misunderstanding. And taking a really basic example, which is some initiative that we've looked at in our project around co-responders of domestic abuse, with an independent domestic abuse advocate that works for our health service. Now, what you might see is an increase of domestic abuse calls come in. That doesn't necessarily mean that that's a bad thing. That might be actually increasing confidence in that community, might be increasing that victim to come forward more. Actually, as a measurement back to government, that might look really bad. So it's about really, truly understanding and picking some of that, which has to happen within these organisations, and from the evaluators themselves, which again comes back to evaluations being multidisciplined in themselves too. Don't just have criminal justice researchers, have public health institute researchers, have criminal justice researchers collectively working together and pushing back on that evidence.
I'll hop in here as well. Just hugely echo everything that Michelle just said, particularly around multidisciplinary evaluations to show program impact. And also, I think the source of the interest in these interventions is really important. I think you want them to come from the community, right? Especially here in the US, we've got such frequent political turnover. The average tenure of a police chief is a few years long. We should be implementing the programs that communities are advocating for, and then they'll sustain any type of change in leadership from the top, because if somebody wants to get elected, they need to reflect the will of the community. But what that means is that it's incumbent on us to educate and empower communities about their options so that they can advocate for something that's actually based in evidence.
I think we don't hear you, Brendan.
Thanks, Jaime. I forget about mute. So from an ex-police police chief's perspective, you know, it is difficult because, you know, you only have a certain amount of time, and you deal with a couple of different pressures. You know, I used to tell folks that, at least I think I mentored, that when they take that job, they have to be ready to just lay their badge down and walk away if it gets to that point where what they're trying to institute for the right way, those pressures come to the point where it's about to go against what they believe, number one. And then number two, you know, I think the biggest pressure when we talk about reforms sometimes comes down to the budget. You know, this is a conversation we have a lot around changing policing and stopping arresting people, because of course that means budgetary assets are going to go down, and the recognition that, like, we're not supposed to use the criminal justice system to feed the budget. That's not the appropriate use. So I certainly remember some conversations about, well, you know, fines have gone down. It's like, well, yes, that's because we're not going to arrest and ticket as many people. That was the plan moving forward. So absolutely. I mean, I didn't know, besides making sure I could be heard, did you have something you wanted to say there besides correcting me? Thank you.
No, I think that I echo what the two of them said. I think one important part is, how do we institutionalize the projects beyond the personalities who created them, right? I think we tend to forget sometimes that people are there momentarily, but institutions last longer. So I always make the emphasis, also coming from this triage perspective of being in academia, activists, and government job, that, you know, we need to sign agreements between institutions rather than just the people that represents the institutions. Because if people changes, then at least between the institution, there can still be written memory that there was some collaboration there. And for the next team that comes in, there's something that they can build upon, right? And sometimes I think we're trying to forget that. And many of these things ended up just being there because some people decided to make it their personal project, but then when they're gone, everything dies, right? So what can we sustain these things more collaborative? We'll have some written agreements about what the objectives are, how we got to evaluate it, and well, with the impacts that we have in our community. So then the next policymaker that arrives has some context and cannot walk away that easy from those commitments.
Yeah, you're saying community, and I know Mo brought up community. I think community is definitely the key, because communities, when they drive things don't go away based on who is sitting in what chair. So it's a great point. All right, awesome. So I just want to turn to one other thing before we open things up, and that's, you know, one of the things I was pleasantly surprised in, and I've had the pleasure of sitting in on some of the calls with Mo on the North America stuff, is some of the other things that maybe we weren't thinking of when we first started this, of things that folks have found out that people want to be interested in, that will take us down a different road. And one of those is, you know, we've talked about response to mental health calls across the globe, but one of the things we heard was also about, well, what about the folks that are doing that response? What about the police? And then we got in a really good conversation about, let's talk about the police and the social workers. Like, if we're going to bring a whole nother group of folks in that are going to be the primary responders, like, what do we do to make sure they're okay? What do we do to make sure that, you know, I have no problem. I tell people all the time, I lost empathy at one point in my career. And when you lose empathy, if you're going to go on a mental health call, there might be a problem there. So, you know, Mo, do you mind just kind of touching on how that conversation went? And then folks in the other regions, like, what have you guys found that have been kind of those pleasant surprises that have popped in your conversations around this work?
Yeah, I mean, the conversation went in a really interesting direction that, I'll be honest, I didn't anticipate. But, you know, we sort of falsely siphoned off practitioners and responders as if they aren't part of a community. And when you're looking at sort of public health interventions, it's really important to look at the interventions that support their wellness as well. There's research here about how there's a really shared exposure to trauma. So a lot of the trauma sources in a community are the same trauma sources for law enforcement and first responders. So a lot of the interventions we're talking about for communities could also be helpful for the first responders that support them, but we just need increased attention. And we're actually currently in the process of compiling a lot of different innovative ways that jurisdictions are supporting their first responders. It's a complicated discussion, right? Because here in the US, especially, there's a real shift or there's a real push to shift resources away from police departments. But if part of what we're arguing is they need better mental health support in order to navigate the trauma that they're exposed to, that is a resource requirement. So it's complicated, but we're certainly paying attention to it. One thing I think is really important is just the acknowledgement that it is likely that as a first responder, you will be exposed to trauma. Right now in the US, a lot of departments tend to put the mental health intervention after somebody's been exposed to trauma. And at that point, it's almost too late because the resilience hasn't built up. So really changing it so that it's part of just a basic training to have that profession so that you actually understand how to build resilience before you're exposed to that triggering factor. It's a great question.
Moon, I know you had your hand up, I believe, so I want to make sure I get you.
Yes, I wanted to comment on the issues of sustainability as it relates to collaborations. And I've seen that in most cases around Africa, it has been very problematic or challenging, especially for civil society organizations to form partnerships with law enforcement agents. And what I've seen to work in some countries is when the law enforcement agencies make it part of their performance systems, whatever they want to achieve, whether it's health outcomes. I think if it becomes part of their performance system, I think it works to be better, that they are kind of either forced to implement certain projects and programs that relates to increasing either knowledge or changing attitudes or practices of the police officers. For example, with the South African Police Service, there is a program that they're implementing that relates to sex work, drug use, and people use on LGBTI. In most cases, these issues, they always say, they are not their mandate, but when you make sure that it's part of their performance system, they report on a yearly basis to it, it actually becomes better and it adds to sustainability that in the long term, they always implement those programs and so on. Thank you.